everyone. Thank you for coming out this morning. My name is Michelle Hayden. I'm the HCBS Director of Home Community-Based Services for KDADS. I brought a couple of program managers with me. There's Chris Lutron. He's our Fiscal Disability Program Manager. He's pretty new. And also we have Todd Seagraves, who's our ADRC Program Manager. So they're here to help me answer questions and move forward with this presentation. So as Carrie said, every 5 years we need to do a waiver renewal. That's part of the process. Or if we amend a waiver, we also need to do public comment and put that out there. But this is the 5-year mark for the physical disability waiver. So what KDADS has done is we've gone through and we've made some edits ourselves as far as things that we feel need to be addressed. So I will be going over those, but this is also one of your opportunities to have feedback as to things you would like to see different or stay the same within the waiver. If you're happy with your services, or if you have concerns about services. We'd like to take this opportunity for you to go ahead and talk about that, and we'd really like your input so that we can take that back. So today, we're going to start with the physical disability waiver. We're also, a little later this afternoon, we're going to do the frail and elderly waiver, which is also up for renewal. So the waiver renewal timeline is that this waiver will be renewed at the 1st of January 2020. So we start this process far out so that we can get public feedback, we can go through all the rights and rewrites of the waiver. So we're working on that right now. This is one of our steps. I'm going to take you through reviewing how the waivers are organized. And then we're going to do a review summary of proposed changes. And then finally we're going to do review changes by appendix. And I'll show you that here in a moment, just so you kind of understand how the waiver is organized. And we'll take a couple of times to take questions and comments. The WSU staff will come around and if you have something you want to ask or make a comment on, they'll take your comments. So public comment period is April 16th through May 16th, 2019. You can submit them by email. That's to Anita Llewellyn. She's one of our administrative assistants. She's going to be tracking all of those comments so that we have them. Or you can do it either by her email or by you can send it in the mail. And all public comments are private. You don't have to put your name in or anything. So a waiver is a pretty dense document. So I did want to explain to everybody how they are organized. And if you think of appendices as like chapters in a book, that's how they're organized. So the appendix A just talks about how we administer our waiver, how it operates. Appendix B talks about participant access and eligibility, how people access the waiver, how they're eligible for the waiver. Appendix C is, we talk about participant services, and this generally tends to be the appendix that people are most interested in. And it talks about all the services that are offered through the waiver, what their scope, duration, limits are. Just tells you all about those participant services. Appendix D is our participant-centered service planning and delivery, what that looks like. If you're become eligible for the waiver, what to expect then, and how that process will work as far as setting up your services. Appendix E discusses participant-directed services, so those are all your self-directed services, how those work. Appendix F is the participant rights. It talks about everybody's rights that you have while being a participant on the waiver. Appendix G is participant safeguards. Appendix H talks about our quality improvement strategies for CanCare and for KDADS as part of CanCare for the particular waivers. Appendix I is financial accountability. And Appendix J is cost neutrality demonstration. So whenever we have a waiver, we have to show that the services we're providing in the community are at least neutral to those that we would provide in an institution. So they at least need to be less than or the same as it could be provided in the institution. And for the fiscal disability waiver, our institutional equivalent is a nursing facility. So we look at those costs. And I'm not on that end of it. We have people that crunch all those numbers. But if you have questions about that, I can probably get answers for you regarding that. So we have some changes, and most of these are just minor changes, but I did want to go through them a little bit with you. We'll go through them as we go through the appendices. We have some changes to the language regarding background checks, and it's just more clarification around what the process for that is. We have a KBI background check, health occupations credentialing background check, and so we enumerated that in the waiver language. The next is we had some changes for the personal care services, informal and natural supports, just talking about that, clarifying some of the rules around those things. We also made some changes to the home and community-based services institutional transitions, how those work. Many of you are aware that we had money follows the person until the year before. We've kind of finished that up, but we are continuing with having institutional transitions. We also changed the language from sleep cycle support language to enhanced care services, which means the same thing, it's just new language. And that has happened since we had our renewal for this waiver. So where you have previously seen sleep cycle support, you will see enhanced care services. We did some updating to the fair hearings process, and this is in response to contract changes and also with CMS that we have shown some new steps with the fair hearings process. We also did some changes for abuse, neglect, and exploitation. Just talking about how we report those through our new AIR system, so that people understand how that works. We talk about adverse incident reports in the waiver renewal. We've enumerated a little more clearly about person-centered service planning and how that process works. We will be talking quite a bit about performance measures. So for almost every appendices, we have some performance measures that we have been working with CMS on, and we have done some tweaking of some of those performance measures to make them more clear and to make sure that they're addressing the needs of the waiver. And we do have some other policy and law updates in there. So most of this is pretty dry material, but I'll try to go through this with you. And I certainly want you guys to talk about whatever it is you want to talk about or have questions about this. So in Appendix A, it basically just tells what the waiver description is, what it's there for, what we're doing. We also talk about the home and community-based services settings, final rules, state transition plan in there. And for those of you that don't know what that is, it's that we are working to make sure that we have that persons with disabilities statewide have access to community services and are integrated into the community. And that's a very short explanation of that. But we've been working on that for some time, and we need to come into compliance by 2022. So these are some of the performance measures that we have that we're going to be reviewing. And the performance measure is, these are tracking information on number and percentage of quality review reports reported by KDADS, and the number and percentage of amendments and renewals reviewed and approved by the state Medicaid agency prior to submission to CMS. Number and percentage of waiver policy changes that were submitted by the state Medicaid agency, and number and percentage of long-term care meetings that were represented by the program managers through in-person attendance or written reports. So these are some of the measures that CMS we agreed to take to make sure that we're following through with our administrative functions. So Appendix B, participant access and eligibility. Here we're going to talk about, this appendices really talks about reserve capacity. So we do set aside capacity to take in folks that certain groups such as military would have an exception to be on the waiver. We have a crisis exception policy for those waivers that have a waiting list, and the physical disability waiver does have a waiting list at this time. We also do that for individuals that are in the custody of DCF. The physical disability waiver goes from 16 to 64, so children in custody that need to access those services would bypass the waiting list. And we made some changes on performance measures here. Those performance measures are, we were measuring the number of persons who were determined to be level of care prior to receiving HCBS services. Now we're just looking at only those that are newly in the waiver and have that level of care to make sure that they need that they are receiving HCBS services. We're also looking at the number and percentage of initial level of care determinations that use the state's approved screening tool. And we were looking at all people that were going through the annual level of care, but we narrowed that down to just the people that are beginning with getting their level of care assessment that are done through the ADRCs. And we removed one of the performance measures, and that is to assure that people are getting, that they're getting their annual level of care done within 12 months of the previous level of care. We're still doing that, we're just not tracking it. So people that are on the waivers do need to have an annual level of care every year. We've removed another performance measure, number of percent of all level of care determinations made by qualified assessors. We track that, make sure that all the assessors are that meet the criteria to be an assessor. We do reports with ADRCs on that. Number of percent of initial level of care determinations made with the level of care criteria was accurately applied. We still are reviewing that. That's just not a performance measure any longer. And the number of percent of initial level of cares determinations made by qualified assessor. And we are just going to be, instead of looking at all of them, we are going to be looking at just the initial level of cares and making sure that they were done by a qualified assessor. So Appendix C, these are the changes made here. This is probably the one appendices that people are really interested in. We, as I said before, we changed sleep cycle support to enhanced care services. We better defined informal and natural supports for personal care services. We talked about provider types and in the waiver. And this is where we talk about our background checks. And we did make some tweaks to our performance measures. So our performance measures for this particular appendices is number and percentage of newly enrolled waiver provider organizations that are licensed, certified by the state, has met all licensure certification requirements and other standards. We also talk about number and percentage of enrolled waiver provider organizations that that are licensed and certified by the state, that continue to meet all licensure and certification requirements and the standards, and then number of percentage of newly enrolled waiver provider organizations that are not licensed or certified by the state, and that all provider organizational level waiver standards. We also have number and percentage of enrolled waiver provider organizations that are not licensed, certified by the state, and continue to meet all provider organizational level waiver standards, and number and percentage of enrolled providers that met training requirements as defined in by the state. So these performance measures we're looking at to make sure that all providers have the appropriate licensures or set of certifications if they are required for that particular service, if not just that they have met all the requirements for that provider. So I can take some questions now, or comments, whatever you want.
And again, Danny and Lucy have microphones, and they will bring them around table to table and check in with you and see if you have a question or comment about the waiver renewal that you've heard so far. So that could be a general comment or a question for clarification. See one right here? Sure.
You know me, I always have questions. I have a couple. So the one is about with the old performance measures. The one thing is with the changes. Are you guys planning on having someone to check if they did have the changes with the measures to make sure that they did have the changes? Because we had talked at some of the meetings with the other waivers, like the TBI and the other waivers, to make sure that they did make the changes. Because I know some of the agencies said that they made the changes where they really didn't. So are you planning to make sure that that came about?
So we have we are standardizing these performance measures across waivers as much as we can. And part of that, yeah, we are doing some checking on whether they're getting these performance measures taken care of. Part of our quality team evaluates a number of these measures for providers through our provider enrollment process. They're going to have to be able to prove that they have the right credentialing, they're meeting the requirements of that waiver. Also, with the MCOs, they also have to do a credentialing process for all of the providers that are contracting with them. So there are measures to help with that.
And one thing I noticed wasn't done is, I think with all the advocacy I do is, one thing that hasn't been changed is the cognitive, for people that are changing from other waivers, is having cognitive programming for the physical disability waiver, because people on the TBI waiver and the frail and elderly need cognitive programming on the physical disability waiver. And that's one thing that hasn't been added, that was removed. And I was wondering if that's something that's being planned to be added to the physical disability waiver.
Heather, we're happy to take a look at that. Can you explain a little more about what that service looked like?
Yeah, on the TBI waiver and the frail and elderly waiver, a lot of people that come from the TBI waiver that are put on the physical disability waiver, and people with epilepsy also need help with cognitive programming, like they need help with having cueing and different things like that, and also with cognitive function. And that's not something that's on the physical disability waiver, because we're on the TBI waiver or the frail and elderly waiver, they need help like with reminders and things like that. on their daily living, and that's not something that's on the PD waiver. Because when you're on the, TBI waiver or the frail and elderly waiver, you need help with daily functioning like that, and when you're on the, TBI waiver and immediately put on the, PD waiver, a lot of people still need help with that kind of stuff. And when you've been on the, TBI waiver for that amount of time, and when you're automatically put on the physical disability waiver, that's something that's still needed help with. And that's something that they're taking away automatically. Even someone with epilepsy or other types of, when you're aging or whatever, that's something that still needs help with, and that's something that they're not given. And a lot of meetings I've been at for people with TBI or other disabilities, even with dementia, that's something that's needed and they're not given. And that's something that we wanted, a lot of people wanted to, me represented at this meeting to be looked at. It's been talked about a lot of meetings, and that's why I wanted to come today and to be represented for this, to be looked at, because a lot of people need that verbal hearing or things like that, or even, different methods of cognitive support. So that's something we really wanted to be looked at.
So Pam, how long ago was it removed from the PD waiver, do you remember?
5 to 10, I can't even remember, it was quite a while ago.
I'll look back at older waivers and see if I can find that.
It was quite a while ago, and
Okay.
that's been something that a lot of people need support with.
Thank you.
And another question, sorry, I have a lot of questions, you know me.
Okay.
The one question I had was, it wasn't a question, it was another thing. When the change in with the background checks is a lot of people need, is adding money for the cost of background checks. Because that's a suggestion, because here's the problem people are having, is the attendants need to pay to get the background checks. And a lot of the even before they're hired, and or the person has to pay for that, and that's a cost, because a lot of defendants don't want to pay for that. I don't know if that's something we need to talk to the MCOs about, but, I mean, it costs, some agencies you have to pay $15 to $30, and attendants don't want to pay for that. And so, and neither do the attendants, because they have to pay, even before you're hired, you have to pay for that background check. So, I mean, a lot of people, that's hard on the consumer or the attendant. Even before you have to, you can hire someone, you have to pay for that background check. So the suggestion is to add money to the person to pay for a background, like, even if it's $100 a year or something like that for the background check. That's another suggestion a lot of the consumers have, is to pay money for a background check a year into their budget. That was another suggestion. Some states do that.
Okay.
Great, thank you.
Do you have another question, any other questions or comments? Again, I'll just have you raise your hand so that Danny or Lucy can bring a microphone over to you.
All right, well, I'll take a couple here since Heather warmed us up here and did a great job of asking questions. I guess one feedback that I've gotten from several folks, and I know there's a statute that was recently, I guess, enacted regarding that, and that was attempting to kind of standardize that and set up a new process. Some of the feedback that we've gotten from folks, well, we understand the need of having that and ensure that bad actors in one state. One of the challenges is that the individual who's self-direct, they want to hire like a care attendant, for instance. So they go through this process. At the end of it, they get essentially a thumbs up or thumbs down, and without really the opportunity of hiring the person anyway, even if they're aware of a past indiscretion of the person. And the issue too, that even though that turnaround has gotten a lot shorter, that's still a barrier. If somebody needs to hire a care attendant, they probably need them today, and likewise, the person needing the job, right, needs the job today. And so that actually serves as a barrier, especially for people self-directing, and I think it goes along with what Heather said too about, you know, the fee that goes with it. And so just, I think the feedback, if as the agency could look at that going forward, I know we're quite a ways down the path, but looking at possibly, you know, as it relates to the waivers and in turn possibly amending the statute to allow a little more, you know, provide necessary protections, but also allow for some flexibility for the individuals who are self-directing, especially to be able to get a copy of the background, again, because in all intents and purposes, they're the employer. And so we're already requiring the background check, why not, you know, set up that process so they could be the information and then make an informed decision without kind of, I think, taking a paternalistic view that people with disabilities can't make those decisions. And so that's, I think, one barrier to self-direction that's come up. One other thing that I just want to put in a plug with the recent federal MFP, they continued funding throughout the remainder of the federal fiscal year. And from some of the reports, I think others have shared that with you as well. We want to encourage the state to pursue that and get that funding up and going. And obviously, as that relates to this waiver, especially if there's some opportunities there. And then I had a question too on that performance measure on the not reporting levels of care evaluations. Well, I know that's no longer a federal requirement. Is that something that you're still going to require and do and have that information be publicly available?
Might be talking about the levels of which.
Yes, the performance measure that's removed, that you highlighted, that's
Oh,
no longer required to be reported. Let's see, the number and percent of waiver participants who receive their annual level of care evaluation within 12 months of the previous level of care determination.
Yeah, we're still requiring that, and we do track and report on that. Todd, we did that information every month on number and level of cares that are reported from each ADRC or entity.
So essentially, the only change will be the fact that you will no longer be reporting it to CMS.
Right, correct.
Those are my three that I had so far. So
Okay,
thank you.
okay, other questions or comments at this point? All right, if you think of something, we'll have more time at the end of the session, but for now, we'll go ahead and continue on.
So we're going to move to Appendix D, and this talks about person-centered service planning. So we have a new performance measure for this appendices. We're going to be tracking the number and percentage of person-centered service plans that contain the signature, date, and signature of the participant or their legal representatives, applicable service providers, and care coordination. We are removing number and percent of waiver participants or their representatives who were present during the involved development of this service plan. And we're removing number and percent of waiver participants whose service plans were developed according to the processes in the approved waiver, and the number and percent of service plans reviewed before the waiver participants' annual redetermination date. And we did these for various reasons. The last one was because it's similar to some other performance measures. We are removing the number and percentage of waiver participants with documented changes in needs whose service plans were revised as needed and address change. Number and percent of person-centered service plans, initial and annual updates signed and dated with contractual timeframes. We removed the performance measure that number of percent of service plans reviewed at least every 90 days. And we changed the final one there is number percentage of waiver participants who receive services and supports as authorized in their person-centered service plans. We just made some minor changes there, but no change to the meaning of the performance measure. We have removed the number % of survey respondents who report receiving all services specific to their service plan. We removed that measure. Number and % of waiver participants whose record contains documentation indicating a choice of community-based services versus institutional alternatives. Also, we are changing from number of % of waiver participants whose service plan address the participant's goals. And this change has really no change to the original performance measures, just reworded. And finally, here on this page, we have number percentage of waiver participants whose person-centered service plans address their assessed needs and capabilities as indicated in the assessment. So what our quality team, I can tell you a little bit about that, but what our quality team does there is they'll look at the assessment and then they'll look at the service plan and see if there's assessed needs that aren't addressed, or make sure all assessed needs that are called out in the assessment are addressed in the person-centered service plan. We also have number of percentage of waiver participants whose person-centered service plans address health and safety factors. We did a little minor changes to that one. Number and percentage of waiver participants who record contains documentation indicating a choice for waiver services provided. Number and percentage of waiver participants whose record contains documentation indicating choice of waiver services. And number and percentage of waiver participants whose record contains documentation indicating a choice of either self-direction or agency-directed. So in these measures, we're just looking at the person-centered service plans that we poll every quarter with the MCOs. We look and see if this documentation is present in those for those measures. Appendix E, we didn't make any changes there. That's for participant-directed services. Appendix F, this covers fair hearing, that's participants' rights. And Appendix G, participant safeguards, that we talk about the AIR system, and we had some changes for the performance measures. We just give some clarification on these. The number % of waiver participants who have disaster backup plans, number percentage of unexpected deaths reported to KDAS for which review resulted in identification of non-preventable causes, number and percentage of unexpected deaths reported to KDAS for which review investigation followed the appropriate policies and procedures, and number and percentage of preventable unexpected deaths reported by KDAS that resulted in a state-issued corrective action plan, otherwise known as a CAP. So there we're collecting data to make sure that people have a disaster backup plan if something happens to their service provider. We're looking at unexpected deaths and looking at, making sure that there wasn't something that could have been done to prevent that. We're also looking at number and percentage of adverse incidents reported to KDAS year to date that were initiated and reviewed within required time frames, number percentage of reported adverse incidents reported to KDAS for which review, investigation, follow the appropriate policies and procedures. We did remove the measure of waiver participants who receive information on how to report suspected abuse, neglect, or exploitation. And we have a new performance measure, number and percentage of DCF screen-outs, substantiated or unsubstantiated adverse incidents where KDAS subsequent review followed the appropriate policies and procedures. These measures are tracked by our PICU team, our performance PICU team at KDAS, and they pull all these reports out of the AIRS reports and collect that data. follow procedures as specified in the approved waiver and removed since it's similar to other measures. There is none of that allowed on the PD waiver. So there should not be any. Number and percentage of unauthorized use of restrictive interventions that were appropriately reported. Again, this is not a concern for the physical disability waiver. And the number and percent of waiver participants who receive physical exams in accordance with state policies. So it has some minor clarification on that one, and that people are getting their annual exams within a 365-day period. So appendix H is no changes. I'm going to have Carrie hold it, she's better. So that's a quality improvement strategy. Financial accountability, we have some changes to performance measures. And there's a number, percentage of claims that were paid by the Medicare organization within the time frames specified in the contract. And number of percentage of payment rates that were certified to be actuarially sound by the state's actuary and approved by the CMS. And then we did remove the number and percentage of provider claims that are coded and paid in accordance with the state's approved reimbursement methodology. And so appendix J, there were no changes made to this appendix. So with that, do people have any questions on it? Thoughts?
So that does get us through the changes that are being made to the waiver, so we'll use as much of the rest of our time as we need to take any additional questions or comments that folks have. And again, I'll ask you to raise your hand so that we can bring you a microphone and make sure everybody can hear you.
There was a couple things. With the hearing part, I noticed the MCOs have a different amount of time for hearings. Why is that? Like if you get, like, say when you get your, you'll get the, when you have your, give me a brain freeze. When you get, they'll do your, assessment. I noticed with the different MCOs, you'll get a different amount of time to do your, what were they thinking of? Appeal. Thank you. Why does each MCO give you a different amount of time? One will give you 30 days, one will do 60 days. Why are they each giving you a different amount of time?
Heather, they should be giving you the same amount of time. It should be 60 days, plus we have 3 days for mailing.
They're not
So,
doing that.
thank you for bringing that to my attention, and I'll be taking that back to make sure everybody's sending out the correct appeal information.
They are not doing that.
Okay, thank you.
And the other thing is, if the TBI waiver gets approved for acquired, is there gonna be a system with a waiting list for the PD waiver? Where, cause a lot of people on the PD waiver, there is people that have acquired brain injury. Is there gonna be a system where you look at the waiting list on the PD waiver to see how many acquired, to look at that waiting list for the PD waiver? How many are acquired brain injury to put them on the TBI waiver? Do you get what I'm trying to say?
Yeah, I know what you're saying. Yeah, we've had some meetings about that. We haven't really come up with exactly how we're gonna work that, but we do realize that there are people on the physical disability waiting list as well as the IDD waiting list that may have acquired brain injuries that might benefit from the brain injury waiver when it becomes the brain injury waiver. So we are looking at how we're going to try to approach that. Haven't come to any conclusions yet, but we'd be very happy to hear some input from people. If you have ideas about that, that would be great.
I just wondered if there's.
Yeah, we're concerned about that because we do have people that are waiting for services that don't currently qualify under the TBI waiver that might qualify under just a brain injury waiver.
Who else has a question or comment? If you're letting it stew a little bit, I want to remind you that you do have other opportunities to share your questions and comments with KDADS. The third slide of the presentation has the information for how you can share your feedback outside of these meetings.
Well, I guess I'll take another bite at the apple if no one else has anything. So Michelle, I guess my question, you said there were changes to the fair hearings section. I was curious if you might be able to summarize what that change is. I attempted to do a quick look while we're here and thought you...
Those were pretty minor changes. The system is the same. It just enumerated probably more clearly what the hearing process looks like. I think before it was a little more difficult to understand. We put in the time or what the process looks like when a person served is getting a notice of action, what the process is, that they start with the MCO and then they can go to state fair hearing if they don't like what they're getting, their solution with the MCO.
And is it the same timeline as the way it works in practice with the 1115 waiver process? And the reason I ask is because we worked with CMS, worked with KDHE as part of a group to do that, to change, because based on their interpretation of that CFR, they tried to say, it had to be a certain date, that you couldn't exceed it. And KDHE went to CMS and appealed a waiver for that reg, and CMS granted it, that extended that timeline. And that dealt with the continuation of benefits throughout the process. And then also working with them on the notice of action to make sure, because historically they were not always the same and not clear. And we, again, worked with folks to try and put it in plain language and make those a little clearer. And I think that process is, at least as far as I know, has been working reasonably well here in the last year or so since that change happened. But I just want to make sure this isn't deviating from that process at all.
My understanding, no, it's not. Then we have KDHE look at that and make sure it's all in line with what they're doing. So it should be the same.
And then I guess my other question kind of that popped to mind is the reporting of seclusion and restraint. And without delving into the weeds too far, you basically said that there were two performance measures that were similar, and it looks like you've essentially combined them.
Right.
But so any, because aren't they currently banned or prohibited under this waiver?
Absolutely. There's one waiver that does allow that, and that's the IDD waiver. And in our effort to standardize performance measures across waivers, we've left it in all the waivers, although we're very clear that it doesn't apply. But should something like that happen, we would track that data on this other waiver, other waivers, but
So
it is strictly forbidden.
okay, yeah. So I was just, as I was reading the new measure, I just want to make sure that any use would be an unauthorized use, and therefore would have to be reported.
Yes.
Okay, perfect.
Yeah, that's how we're viewing it. For the IDD waiver, if someone has a written plan, and that's part of that, and it goes through all the
There's a
things.
lot of process that
A lot
goes
of
through that,
process.
including, I think, the signature of the head of that facility.
Yeah,
Or it
there's a huge
happens, so.
process for that, so if that should happen there, they would need to report that, and we'd have to review it to make sure they followed all the appropriate processes.
Okay, so appreciate it. Thank you.
Sure.
Question?
Hi, I just have a question on the summary of proposed change sheet. One thing that was mentioned was PCS, informal natural supports. is there a change to the definition or anything? What is, that really wasn't touched upon, so I wasn't sure what that meant.
It was more clarification on, we changed some language in there, it means the same thing. It wasn't really, very clear, so we just wanted to make sure that we define each of those clearly within the waiver. You can certainly take a look at it and make sure that,
But the rules haven't changed, is what
No.
I'm getting at. Okay, thank you.
Any other questions or comments so far? Let it set for just a minute. We don't want to close out too early. I do want to, again, remind you that you can submit comments outside of these meetings and also using those note cards on your table. If you prefer to write your question or comment down, you can do that as well. If you want to come back and hear this again and share your comments that way, you're welcome to join us this afternoon. We'll have this presentation here again in this room today from 3:30 to 5. So if you want to come back and think, if you think of something later and want to come back and share it at that meeting, you're welcome to do that too.
I just wanted to tell you that outside these doors, Lisa Churchill from the Ombudsman's Office did have some flyers talking about just general information about the waiver. So if you would like to pick one up, please do. And we'll be here for a little bit if you want to ask any of us questions afterwards.
Right, I'm not seeing any hands, so I will go ahead and conclude for this session. Again, thank you all for taking the time to be here today and hear what is changing and share your questions and feedback. If you think of something later on that you wanted to share, remember that you can provide your public comments up until May 16th. So you have until the 16th to get that feedback into KDADS. And again, if you wanted to talk to somebody one-on-one, we have the state staff up here as well as Lisa from the Ombudsman's Office. Feel free to stop any of them and chat if you need to. So thank you all for coming out and have a great rest of your day.